I'm Alan Faden. I'm a neurologist by training. I'm recently recruited here as the director of the Shock, Trauma, and Anesthesiology Research Organized Research Center. The STAR Center was envisioned before I got here. It was actually envisioned by Tom Scalia and Peter Rock, representing the trauma program and the Shock Trauma Center on the one hand, and anesthesiology on the other. Together with the dean, Al Reese, came together and decided that the time was ripe to develop a very powerful research component to our trauma clinical programs, which are probably the best in the world, and really use the patient populations to redefine in a research capacity how best to treat a patient, with the goal of changing the way the world treats trauma patients. Probably the most important thing we've done in recent years has been to identify the fact that trauma leads to the generation of gene responses, including those related to inflammation in the brain, that occur over very long periods of time, much longer periods of time than people have accepted in the past. Indeed, probably certain of these responses we've identified perhaps occur forever after a traumatic brain or spinal cord injury and lead to continued tissue destruction. What's become appreciated in recent years, A, is the fact that in the wars in Iraq and Afghanistan, in part because of the improved protective gear of our soldiers, that head injuries become the signature injury of that war. In fact, more than 20% of military personnel deployed to war zones have a subsequent head injury. That's an enormous number. And on the other side is the sports related. As sports have taken off, and particularly as women's sports have taken off dramatically in recent years, there's been an increased recognition in the problems associated with concussive brain injury. So although the gospel in our field is that after brain or spinal cord injury, it may take hours, it may take a day or two, but certainly within the first several days, it's all over. And whatever you can fix is fixable then or not. We've taken on that tenet and tested the idea that because inflammatory cascades go on indefinitely, that we potentially can intervene months or years after an injury and make a difference.